Good morning, everybody. It's Dr. Pearlman, and I wanted to make a little old school video and get right to the point. What should you do? Should you go see a chiropractor or an acupuncturist for your pain? My friend says that acupuncture was the cure. Another friend might say, I went to an acupuncturist, didn't really help. I went to the chiropractor, they're a miracle worker. Go see Dr. Pearlman. Oh no, I didn't just say that. They're the best chiropractor. And another person might say, chiropractors don't do anything. You might as well go get a massage, which probably brings us right down into the number one topic. Should you see a chiropractor versus an acupuncturist? And so chiropractor, what's up with that? Well, 90% of my patient population comes to me because of back pain. There it is. It's that simple. For those of you out there that are thinking about becoming chiropractors, know that 90% of the people that come to see you are coming in for back pain, not what you think the problem is, not what you know the problem is, back pain. So get really good at caring for and treating back pain. And then from there, you can build on other things. When people trust you, they will only be looking to you towards what you actually can help them with. And again, it's about a trust, it's about rapport, and you having their best interests at heart. So as it goes in all factions of medicine, in all faction of healthcare, and in every faction of business where you are selling a product or a service. So here we go. Chiropractic, should you see it? A lot of people come to me for back pain. A lot of people go for back pain. Here's the thing that you have to understand, and this is applicable to both chiropractors and acupuncturists, is they work on something through the nervous system. That's right, guys. It is a nervous system stimulation, both practices. And this has to do with the periaqueductal gray. That is the midbrain sort of, I don't want to call it a tract, if you will, that has everything to do with pain inhibition. When we talk about pain inhibition, it's easy for people to say, like I always used to say in my videos, and I still do, the nociception inhibition. They're the pain receptors. That is how we will respond in a neurologic way that has been quantified on MRI in the way the brain changes. So guys, there's plenty of research on human beings that have shown through spinal adjustments how they are changing based off of what they are, feeling. So it is both subjective and objective in terms of chiropractic manipulative therapy and how the periaqueductal gray stimulates through the midbrain, and how the frontal lobe and the other tracts are, we'll just simply say like upregulated or lit up, and how the pain inhibition is then decreased. The chiropractic adjustment, when it's working on this, the same way acupuncture is, the differences are in where you are targeting. And remember how we talked about 90% of people come in for back pain with chiropractors. Think of it like this. When you're cracking or manipulating the disc, and yes, we do want it to actually achieve a quality of crack. We don't want that high pitch, snapping, ligamentous, spraining sound. We want that deep, thudding, releasing, sort of interstitial fluid sound. And what's happening is there's a pressure gradient change where gas is released from the joint, or air or gas is released, and fluid then goes in to provide nutrition to the joint. Now, let me tell you, there's no blood flow to the discs and to the fibers. So a lot of things where people talk about blood flow to the discs, especially when 90% of the people with back pain also probably have a discogenic related issue, especially when you're past the age of 40, for another video. And so what's happening is there's no blood flow. So we need that vacuum, that discogenic, the pressure gradient effect. So that is the crack. That's the cavitation. That's the one where you feel it right on the spot, or when people get the big adjustments and you watch them on YouTube saying, that's the spot. That is exactly what's happening there. You're sort of breaking up scar tissue, if you will, or intra-spinal, if you will, like adhesions, that is now beginning to let the disc, the IVF or intervertebral foramen, and the facet joints, all three of those, are affected on some level if you're a really good adjuster and you know what you're doing. So again, sorry haters out there, I don't care what your research shows, oh, it's just the facet. When it's in rotation, you are typically affecting mostly or almost all facet and a little IVF, probably very little disc. But when you actually do a Y-axis pull, or a P to A prone, or a A to P, if you will, whatever, or P to A supine adjustment direct through the joint, where you're getting a good amount of lift through the joint, and very skilled practitioners know how to make these manipulative moves, then you are actually affecting disc, IVF, and facet. Maybe not all three at the same time, but you certainly are affecting those, and that is why the brain gets the stimulation that they do, and the pain inhibition dampens. And kind of the summary of the chiropractic part of this is that it is probably best utilized in an acute care situation. And that doesn't mean that you can't go for wellness or maintenance. By the way, no matter who you're going to, if you're a physical therapist, if you're, how should we say this, an exercise physio type person in the healthcare space, you're always going to be selling some kind of wellness. One, it's in your interest to keep the doors open. I mean, that's just being truthful and transparent. But two is there is a lot of benefit, especially if the person is just sitting and stressed all day long and they're getting upper cross syndrome or forward neck posture stuff. To have the body passively reinforced into extension and kind of opening people up, if you will, I mean, that's important stuff. On top of the fact, if you've got the other, group of people, if you will, that constantly are exercising and reemphasizing exercise above all, it's kind of how I got hurt. High impact exercise, going to be really tough on the low back, going to be really tough on the mid back, going to be really tough on the shoulders. Depending on how much lifting you do and straining in the neck, I mean, you could end up having the bilateral brachial plexopathy, if you will, where this is just pulled up on those first ribs and these bundles are just nasty and gnarly and you want to get some work in here. Okay, so this stuff happens. And so there is an aspect of wellness, which now brings me to acupuncture. So part number 2 of this, should you go to acupuncture? I would say, without a doubt, if you are chronically hurt, so it's more of a chronic issue where you're just not getting blood flow, remember, there's no blood flow anyways to your discs. It's just, there's not. They're like, a friend of mine recently put it when I went to a long consultation about my own back. He referred to it as like, because he's an orthopedic surgeon who's pulled many disc herniations out of the body. He says they're like hockey pucks. They're just like these thick, dense, ligamentous almost, cartilaginous material things. Like there's no blood flow to it. It's completely different than the muscle belly getting blood flow, especially in our old age. So acupuncture is really great at taking the topical, if you will, endogenous opioid relief through more of a superficial trigger of the way the needle goes in. You stay there for 15 to 30 minutes, so you're actually deregulating or downregulating sympathetic tone just by simply almost being in this meditative atmosphere. This is true, I'm not making it up. And so it might work on a kind of a chronic, sympathetically tight driven, not getting enough blood flow to places that even chiropractic can't really facilitate. And my personal experience, like many of you out there probably have experiences, once I started getting acupuncture from a very well-trained, good acupuncturist, the difference in my pain level from day to day, especially when I'm working hard, bending, reaching, pulling with different patients, has been night and day. I've went from about a 5 or 6 out of 10 baseline out of back pain to about a 1 to 3 out of 10 baseline where I kind of know it's there, but it's not nearly as intense. And that's all thanks to the sort of chi, the energy that they refer to, which a lot of it is really just blood flow getting back into the places that I don't know if chiropractic can do based on the short amount of time you're with the chiropractor. Again, chiropractor, great for acute, great to affect disc, IVF, and facet, and sort of resetting, recharging the joint. Probably doing more of a downregulation of sympathetic at a snapshot in time, but could also upregulate it depending on where and how you adjust. That's enough for another video. Whereas clearly when you're with the acupuncturist, you're reducing sympathetic tone without question just about every single time. A much more relaxing type of treatment when it comes to time spent. And it is definitely a longer process, but the blood flow aspect of what they're doing and tapping into meridians, as the literature would suggest, from one area to another in terms of that flow, that open, that chi, that travel, that stimulates endorphins and which is pain modulation. In that regard, just like we started this video talking about gray matter or gray within the midbrain and how it affects the rest of the parts of the spinal column and the hypothalamic pituitary gland and tract. See, these are both shared within both professions. So there's a lot of crossover, but the similarity to but the differences really lie in acute versus chronic, longer time in office acupuncture, shorter time in office chiropractor. But like chiropractor, nervous system reset, acupuncture, blood flow, sort of wellness, relaxation, very, very relatable to massage. But here, now we're going to just quick little shout out to a massage therapist. Don't think I'm forgetting about you, massage therapist. When you have a true short muscle, that's right, they exist, meaning an overutilized muscle or a chronic sprain or strain to a joint, and of course, strain would be to the muscle tendinous junction, there's one that's going to be tight or there's one that's going to be long. There's your imbalance. I don't believe that chiropractic adjustment alone or acupuncture can do what a good trained therapist can do when it comes to a pin and stretch technique or a actual like muscle belly sort of distortion, thumb on pressure, thought of as deep tissue, maybe not really. I mean, I'm not a massage therapist, but I want you to understand sort of the overall concept of what I'm going after here. When you need the hands on the muscle to both shorten and or lengthen and or release that muscle tendinous junction, that is where a massage has everybody, beat. And then you could just go back down to like sort of the psychosomatic, and no, it's not in everyone's head. Don't jump out of your seats. No placebo here. Most people come in with the nocebo, actually, meaning they actually think it's going to not help them. They're very, very, this is going to help me. I've been everywhere. And then it helps them. So the reality is therapeutic touch on a psychological level, when you're connecting to someone and show them that you can take away their pain, even if just for a short time, can be very beneficial. There are certain things that will connect us to the moment in time that allow us to feel comfort and feel relaxation and feel trust and feel secure. And a lot of that is how people will get better inevitably. And then before I get off the video here, I want to take a moment to address something, which is that if you think, as a consumer of what we just talked about, meaning you're utilizing chiropractic, you're utilizing acupuncture, if you think that you're going to go in and get healed with like a treatment and that's like the measure of it worked or it didn't work, no matter who you're seeing, you have it completely all wrong, or the chiropractor, acupuncturist, massage therapist, doctor, whoever has not done a good job educating you. You have to understand that this is a wellness maintenance type of lifestyle. And most of it is going to be the concept of simply, you are the Lamborghini, you are the Ferrari, and you better start treating yourself like one or you're going to really not enjoy the back part of your life. Just a fact. I see it all the time. Or you can be somebody who says, yeah, I am a Lamborghini, I am a Ferrari. I've got to take really good care of myself. And that person who's the professional you seek and you trust and you feel comfortable with is simply the mechanic, really. And together because they're responsible for you driving well, they're responsible for you to handling well, and you're responsible to make sure you don't, run off the road in the middle of the day after all the good work has been done. And that is how both acupuncture or chiropractic or anything else can help you when you start to understand the vehicle you have been given, the vehicle that you are, and how best to care for it. I hope this video helped everyone. I'm sorry if it went a little longer than I wanted to, but until next time, it's Dr. Pearlman.